and the Internet of Obscure Medical Things. You have 12 minutes. I believe.
Hi everyone, my name is Khalid Ahmad and my supervisor is Sandra I, and another collaborator is Khalid. The thing is, being the last presenter is you don't enjoy any other presentation. I can keep changing every single minute, learning from you as well. Today my the presentation is about wearable health-computer interaction and the Internet of Obscure Medical Things. So it is about wearables. Wearables are they are transitioning from well-being market to the healthcare, and we could see the data. It's yearly basis. They have been increasing. So this data we got it from clinicaltrials.gov, and if you see it's being increased on annual basis. That's why it was our interest to look into this. We were mainly interested in inadequate reporting of the wearables in clinical trials. So we had to analyze the clinical trials, which is clinicaltrials.gov, is one of the biggest repository in America. And we had to go through the clinicaltrials.gov data repository and search for wearables to see how they have been reported throughout the studies. Before jumping into detail, I will be mentioning some words. For example, here you see manufacturers. Then we have the manufacturers. When I say manufacturers, we mean my Garmin, Fitbit, Wearables. These are the manufacturer names. And then we were looking for something called families. Inside each manufacturer, we have, for example, Fitbit Charge, Fitbit Inspire, Garmin Smart. So there's families we are referring to. And then we have next thing is called models. Inside each family we have models. For example, we have Smart HR, 2, 3, like this. The reason I have highlighted these two, I will be explaining that, is because of the ambiguity we faced in our research. Okay, why is it important to report all this information correctly in clinical trials? It's one of the reasons will be transparency. How transparent it is to report every single detail, possible detail, that's important for the purpose of repeatability or reproducibility. And it is good for good scholarship as well. For example, if we want to repeat a study, if we have all the details, then we will be easily able to repeat the study. If something is missing, for example, we have one person is wearing a Fitbit Charge 4 with version number. One thing I forgot to mention here is something called version numbers for the software or firmware, which is one of the main things that was a part of this study, but I wanted to bring later, so I didn't want to forget it. For example, somebody is wearing Fitbit Charge 4 with version 1, and somebody is wearing Fitbit Charge 4, the same thing with version 5. We, as a computer scientist, I know, acknowledge that these are two different devices, but maybe the doctors or clinicians, they don't know that these are two different devices. That's why we noticed that they have forgot to mention it in their clinical trials. Why is it important? Because it's important for the concern of poor accuracy of devices and lack of system information. And another thing is iterative updating of devices. That means every single time we update a device, it becomes a new device. It's very important for that purpose. How did we go through all the data we had, the clinical database? First, we created a string. This is the whole string. We went through the clinical trials. And then the next what we did, we applied our inclusion-exclusion criteria to the appropriate result. And then the next one, this is basically a work in progress paper. It's not a complete one, so we just got the top 10 and the bottom 10% of our studies to do this paper on it, and the rest will be carried on at the next paper. How do we do it? First, we first search, just a search string, we got 2,179 hits results, and then we applied filters on the website of clinicaltrials.gov, and we got 186. Then the next, we applied the rest of the inclusion criteria, where we had to go manually. So 3 researchers, myself, my supervisor, and collaborator, we have to agree or disagree on individual study, which one should be included or which one shouldn't be included, because the ambiguity I mentioned previously, I'll explain later. So there were a lot of ambiguities, which one to be selected or which one to be ignored. And then lastly, we got only 22, that's 10%, and bottom 10%. We selected those 22 studies. The result we got is from the database. We have 5 unique manufacturers, that's Fitbit, Apple, Garmin, Fitbit, and Amigo. So the total, we had 22 studies. All of them mentioned the name of the manufacturer. The next one, we have 9 unique families, and only 16 of them, they mentioned the family name. And there's the 6, and then another one, model-wise as well, it was only 16 mentioned, and it was unique 10 models. The result we got, the main one is shocking. None of them have mentioned the version number of the software or firmware used on the devices. And the trials we went through was varied. For example, we saw some of them diabetes, some of them for rehabilitation of Afghanistan and Iraq veterans, and the sleep patterns. So we went through different studies, and the database is there are nearly 190 plus countries are there, but we noticed that with our 22 studies, there were only 3 countries there. Only those studies were reported in these 3 countries: that's America, Canada, and Israel. And what we saw next is we were basically going through 3 different documentation. One was the trial record, which was on the website, and then they had another one linked for something called study protocol and statistical analysis. Last, we have to go through that as well to find out if they have mentioned the information about the devices or not. And the last thing, we have to go through publication as well. So because some of these studies they have been published, so we have to go through all these 3 different sources of information to locate our studies, which should be included or not in our study. And one thing we noticed that, as I mentioned before, all studies mentioned the name of the manufacturer, but only 6 of them mentioned the Fitbit only. So we weren't sure anything else, just the Fitbit. And we were confused one place as well, because some of the researchers, some of the clinicians, they mentioned Fitbit as we understood as just a wearable device, as interchangeably. So we weren't sure, but because of the criteria, we had to include it. Okay, so what we concluded from here is that there is absence of information in version reporting. None of them, 22 so far we have been through, none of them they have mentioned the version reporting. So the next one is the ambiguity, which I was referring here. Some of the studies mentioned Garmin and Viva Smart. So we weren't sure, because the first version of most of the devices, they are just the family name. For example, if you see Viva Smart or any other one, Fitbit Charge. So we weren't sure, is this they're referring to the family or is they referring to the models. Then we have to, 3 of us, we have to decide, just from the context, where should we put them. So that was one of the ambiguity. And we noticed that there was a lot of inconsistency in reporting, and it was, we consider that it would be difficult to reproduce those studies if we didn't have enough information. So this was not good for reproducibility or repeatability. That's it for my side. Thank you. Any questions or suggestions? I feel free to ask them.
Thanks. It was well timed. I forgot we used to paper. Well timed. Any questions, comments? I was enjoying this wrong.